morning, everyone. Welcome to the second ADH conference. My name is Allan Guerra. I'm a nurse practitioner with Gastro of Ocean County, and I'm joined today with my colleague.
I'm Jhuli Patel. I'm a PA. I'm working with a solo provider in North Brunswick.
And we're here to talk about collaborating across specialties, how APPs can work with our gastroenterology partners and other providers in the care of patients with PBC. So, Julie, tell me about your experience.
So PBC is a very small population of patients, and I think first identifying those patients is the hardest part. And I feel like just that careful evaluation of patients and actually being able to diagnose them, and then to be able to follow them and treat them, I think is one of the hardest things with this population.
You work with solo practice?
I do.
Okay.
Yes.
Well, I work with 7 physicians. So, if you have one task, there's like 7 ways to do it. So, the most important thing is communicating with your, providers, with your collaborating physicians, and know their approach on PVCs. We follow guidelines, we follow evidence-based practice, but most importantly, we have to communicate with our, doctors on how they manage their own patients.
Absolutely, because I can understand how it can be different amongst providers and treatment. So I can understand that.
So do you guys do like gastromed to like communicate and epic to I guess document your notes?
So we have Athena, which we're using, and so we are using that for monitoring labs and imaging studies. Yes.
Yeah, it's very important that we identify these PVC patients, so we know how to treat them, using evidence-based guidelines.
And I think the other thing is you really have to work in a multidisciplinary care team for treatment of these patients. And I think that's important. So working with, primary doctors, obviously us, and anybody else that would be involved, is very important.
And also working with medical science, our medical science partners, like um, someone from the industry who guide us through treatment of these PVC patients.
hmm And I think the other thing is being able to clearly communicate with patients what is our end goal so they understand treatment and what is it that we're looking for, and whether we're starting medications, what is it that we feel comfortable that the medication is working. So I think that clear communication with patients and other providers is always very important.
And sometimes we need to address the social economics of our patients. We have to work closely with social workers and case management team to better facilitate the acquisition of like medications, facilitate diagnostic studies, or even labs. In some cases, some patients need like assistance with transportation, going to their doctors, going to their office visits, and things like that.
Right. And I think being the best advocate for your patient is the most important. And as you know, getting medications approved and all that is not an easy feat. So really to be able to do that, I think is very important,
Right, right.
especially in
It's
this.
very important that we work closely with our medical assistants, our practice managers, our office managers, everybody who's like, part of the ADH system. Like, we have to work together so we can help these PVC patients.
Absolutely. And just have a clear communication to really ensure a seamless patient experience.
Now, do you work with gastroenterologists or just hepatologists?
Also, gastroenterologists, we also do hepatology as well.
Right, right. In some cases, if there's like complicated, patients, we try to, because we work with gastroenterologists, we refer them out to like hepatologists. We don't have a hepatology, specialist in our practice, but it comes to a point where and they need like complex medical care, then we reach out to our colleagues.
Absolutely. And I think that's fair to do as well, just because I have so much more of that experience with hepatology specifically. And so again, because this is a very small niche population, I think that's important to do.
Yep. Well, thank you for having us today. We'll see you next year in our third ADH conference.